pull them apart. Bring them out. Don't let me push them together.
Why do we do that?
Because we're testing all your nerve roots. We're testing L3, L4, L5, S1. And then I'll tell her, straighten your knee, hold it right there. Straighten your knee. Good. Bend your knee. Don't let me straighten it. Don't let me straighten it.
So we're gonna have to do that for on Wednesday, most likely.
I don't know. I can't remember.
Possibly, hypothetically speaking.
But let's say somebody hurt their back. If somebody hurts their back and they're having back pain, if you're going to test the integrity of the muscle, of the nerve, you need to check, you need to do a manual muscle test.
Like you
So
would.
to do the manual muscle test of the back, you're really manual muscle testing the legs.
And then also you want this thing.
That's range of motion. And for that, we can also state that range of motion is grossly intact to 3 out of 5, but we're not applying resistance. If this was physical therapy school, I would have you check manual muscle test specifically for the back, but as a PA, you really don't have time to do that.
Yeah.
And then if you're trying to clear someone off the C-spine, if you want to do, it's said to do neurology testing as well. Would it be appropriate just to do like C5 through T1?
Yes.
Right? Because that's, you're just clearing them for cervical. So
Right,
you wouldn't
right.
be, would you want us to also do like cranial nerves? Or are you just expecting dermatonal?
For this test, I'm more expecting, for example, what we talked about in class in general. You want to ask them A&O times 3. You want to know if they drank or they took, if they're under the influence. Then you'll want to take off the cervical collar if you had this. And then
But this is not for
along
Wednesday.
The spinous processes. I don't know. I can't. But that was on the cards.
Okay,
The
okay.
ones that I gave you to practice.
Okay.
But checking the dermatones as well as asking those questions.
But before you go there, you want to check if you want to clear their neck. You want to palpate the spinous processes. Then you want to palpate the paraspinal muscles.
It says so. It says to clear. There's like several things. One of it's the that they're aware.
Yes.
And then do a neurological assessment, head injury, other injuries, alcohol, and then once that's all clear and yeah, no pain. Then once that's all cleared, then you can take the collar off.
Yes. Let's say the way you clear the neck is palpating the spinous processes, the paraspinal muscles. Then you're going to have them, if you feel okay with that, then you're going to have them rotate and bring their chin to their chest and back. And if that doesn't hurt, then they don't have to have the collar on.
Okay.
But let's say they're 80 years old or they're a baby or something like that. You may want to put the collar back on because you don't know if there's something hidden that.
Yeah.
You don't know if there's an adenooccipital dislocation, they can't feel anything, or they're just in shock. And if you have any kind of suspicion, even though you cleared the neck and there's no pain that way, if you have a high index of suspicion that something could happen, you can always put the collar back. Okay?
So after you ask all the questions, before you take the collar off, you want to do the neuro assessment, correct?
What do you mean?
I mean, like in the ER when we clear C collars, we would do a neuro assessment first before we even loosened it, because if they were having signs, we're not going to loosen
Right.
it.
You can do that. Is that what you were asking?
That's what it says on the paper.
Okay. Yes. Okay.
Yeah, and that's what I was asking.
Yes. You can do a brief dermatome assessment. And then let's say you want to check the reflexes just to make sure they're not hyper reflexive or something. You can check it real quick.
And then you can loosen it if you're okay with
Then you can, if you're okay with that, you can loosen it and palpate. Check the range of motion, and if everything's okay and you feel comfortable, then you can take it off.
See, where I worked at, like, they would loosen the collar, but sometimes, I mean, depending on the patient, somebody would still hold C-spine, you know, while they palpated so the person didn't move their neck.
Yes,
Patients, they just go like, what's going on? And then they move.
No. Yeah,
But
you
they
would
did not want them to move until
Right.
imaging was actually done.
Right, and that's what a lot of places do. But I'm just saying, I just wanted you guys to have an idea of how it is to correctly clear the spine, because many times as a PA, you still have to clear the spine, even if you put the collar back on. You know what I'm saying? You still need to know the steps of clearing the spine. Okay. But if you want to, let's say if this was on the test, you can verbalize and say someone would be holding the head while I'm palpating. Blah, blah, blah.
Okay.
Okay. Or the patient is cognizant enough to know not to move while I'm palpating. Because you're gonna have to have them move anyway. You're gonna have to have them do this and do that.
With the collar on?
No, with it off.
Yeah, see, that's where I worked, we wouldn't do that until after they were.
After.
they
See,
had
everybody
X-ray
has
imaging.
different protocols, and the thing is that if, let's say it was just a bump, like you were just driving, somebody just bumped against you, you bumped against someone else, sometimes they'll put a collar on you anyway. It doesn't mean you have a spinal cord injury, and you just need to clear their neck.
But you have to take
So I
off.
just want you guys to just to have
Depends on what mechanism it is.
it depends on your hospital's protocol, all this stuff. I'm not gonna try to
Okay, okay.
change the whole rules. I just wanted you guys to have an idea